All right, folks, good evening and welcome to the call. I'm really excited tonight because we have both Joanne Zeoli of Patient Measure Therapy and Dr. Rick Perlstein. He's with Valley ENT Arrowhead in Australia. I'm really excited for him to share his stories with the new therapy, and Joanne's going to talk about her journey as well. If you guys want to ask him a question or for Joanne, just hover over the bottom of your screen by the Q&A, type your question, and it comes to us anonymously. So Joanne and Dr. Perlstein, welcome to the call, guys.
Thank you.
Thanks, Ben. I'd like to thank everyone for joining us today for our discussion on what I think is one of the most exciting and cutting-edge technologies, not only in my field of ear, nose, and throat and the treatment of sleep apnea, but just in medicine in general. I've been involved in medicine since 1988, and I've been around many technologies that have come and gone. And this one's here to stay. So Ben, let's get started. As you can see on this slide here, it talks about obstructive sleep apnea. And something we should allude to or talk to a little bit first is snoring. There are 170 million people in the United States that snore. And of those 170 million people, 20 million have moderate to severe sleep apnea. There's two areas of blockage that you can see here on the slide. One is the airway anatomy that goes through the nose, and the other one goes through the mouth where we have the palate and the base of tongue. On the bottom right-hand side, what is an obstructive event? What is sleep apnea? And here you see apnea episode number 1. And apnea is defined as when you stop breathing and your oxygen goes below 90%. In episode 1 here, this patient stopped breathing for 47 seconds and their oxygenation dropped to 84%. And then you have even a greater apneic episode, which is episode 2, and that patient nearly stopped breathing for 90 seconds. That's a minute and a half, and their oxygenation went down to 74%. And if anybody who's a bed partner or if you have a family member watching this discussion and you've seen somebody go down to 74%, it's scary. You'll turn white or you'll turn blue. And this is something that your partner or the people in the house are well aware of during these apneic events. What are the consequences of untreated sleep apnea? And there are many. You have fatigue, diminished productivity, decreased job performance, can't concentrate on the job. If you're in school, and many people are going to night school, particularly during these COVID times, and you have to look at a new occupation, you have a hard time staying up at night. Irritability, anger, acting out, headaches, reflux. What's the issues with your bed partner? One of my sisters is a psychologist, and we talk frequently. And one of the things we did talk about is she sees a lot of people for marital counseling. And one of the things that's brought up in their discussions is the issues with sleep apnea, snoring, and marital discord. And it's not uncommon for people who are sleeping with a sleep apneic to have to be in a separate bedroom. And the end game is, if it doesn't get fixed or addressed, sometimes it can end in divorce. Accidents, risk, community safety, driving home. I can't tell you how many people come to my office that have daytime somnolence. They get home from work, it's been a long, busy day, and they've had near accidents or they have had accidents driving home. And what I see is one of the real exciting parts of what we're going to talk about today, and one of the exciting treatment options, is you get into heart and brain health. And there are a number of papers that are coming out that discuss the link between sleep apnea, heart disease, heart attacks, atrial fibrillation and arrhythmias, strokes. And in fact, we're trying to design a program with Arizona Heart Hospital here to incorporate the technologies of addressing sleep apnea, the Inspire implant, and heart health. Frontline treatments, some of you have this, some of you don't, is CPAP. It's a great treatment. I love CPAP, but it's not for everybody. The long-term compliance of CPAP is 20%. Why? I can't use a doc. I can't breathe through my nose. Nasal obstruction. I get too much dryness. It dries out my nose. Use a humidifier. I do use a humidifier on my CPAP. It still dries out my nose. I'm getting headaches from the machine. I can't find a mask that fits right. My face, I've tried 5 different masks. They just don't work on my face. Choking. Every time I try to take a breath at night, I can't coordinate my breathing activities with the CPAP. And then you get into psychological issues. I'm claustrophobic, doc. I can't do this. Alternative treatments, oral appliances. These are good alternatives. I come from a dental family in my background, and I've talked to a couple of my relatives about this, and they do prescribe oral appliances. But by and large, these are going to use as an adjunct with other treatment options, but not used as a standalone treatment. Anatomy surgeries. This is something that is core to my background. This is what we do as ENT surgeons. We're evolving into new technologies and state-of-the-art things like Inspire, but we still do some of these things. And one of the issues, or one of the parts that we do need to address, is nasal anatomy. Maybe that's the reason why you can't use CPAP, but it's also something that may lead to a better outcome if we do address this, if we're going to put the implant in. And then some of you have also had palate surgery, some of you have had tonsil surgery. We have to look at each of these things because we're not looking at just to make you better now. We're looking at what is going to be your 5-year outcome? What is going to be your 10-year outcome? What is going to be your 20-year outcome? There are things on your anatomy that we can address, that we can look at to give you the most favorable outcome, not now, but also in the distant future. How does Inspire work? It's safe, it's an outpatient procedure, and it's as easy as pressing a button and you go to sleep. A short video on how this works. He activates the device, and as you can see, there's stimulation of the tongue, which cross-stimulates the palate, causes the contraction of the muscles to protrude, not blocking the airway, and allows air to go down so you don't develop the obstructive events that lead to sleep apnea and decreased oxygenation at night. It's a safe outpatient procedure. It's done through 3 small incisions. It's a fast recovery. Typically, you can treat this with over-the-counter postoperative medications. You return to non-strenuous activity within a few days. When you wake up, you'll have to wear a sling for 2 to 3 days. Why? Because there are leads and there are wires that are connecting the neck incision to the chest incision to the area that we're monitoring the breathing. We don't want those to pull out. I had a question today, Doc, when can I go climb a mountain? And you're going to have to wait for at least a month before those types of very strenuous activities. I look at it, this isn't dissimilar. You're getting a new knee, you're getting a new hip. You're having some device implanted within you. You want this to settle, you want this to heal. After 4 to 6 weeks, you're good to go. There's an 11-year half-life for the battery. It's an easy change. We haven't gotten to that 11-year mark with the technology, but we will. And then it's MRI safe, performed on the head, neck, and extremities. I think this is a great slide. And this is the stimulation effect of the airway anatomy. And on the left-hand side, the 2 areas that we concern ourselves with is the base of tongue and the palate. And this is without stimulation. And when you think of the airway, you think it as a cylinder. And in this video, it's this little black hole that you see up here. And it disappears. Every time you breathe, there's collapse of both the tongue and the palate. On the right-hand side, after the implant has been placed, you see a protrusion of the tongue and a stiffening of the palate. And even though it wants to close, it doesn't. And what the implant does is it stimulates these muscles to prevent collapse, preventing you from developing and or exacerbating any type of sleep apnea. So what do we do after the implant is placed? You're going to do a visit at either the pulmonary facilities or the referral center that you came from with an Inspire technologist, and you're going to turn on the Inspire therapy for the first time. You're going to establish initial settings that are comfortable and effective. This is not a one-size-fits-all, meaning your care will be individualized. because the settings that we have for one patient, which may be a relative of yours, that may be a friend, is going to be different than yours because every patient is different. And we learn how to use the Inspire Sleep Remote on these follow-up visits. Indications: moderate to severe obstructive sleep apnea. You have to have had a recent sleep study within the past couple of years. Unable to get consistent benefit from CPAP, many of the reasons we discussed previously. Not significantly overweight, having a BMI less than 35, passed an upper airway exam called a drug-induced sleep endoscopy, age 18 or plus, but the indications are being extended now into pediatric population, and is covered by 85% of the national approval rate for insurances.
So, Doc, this is Joanne's sleep study, and for those people out there that say, "Gosh, this looks like a lot of stuff here," can you explain in layman's terms to the folks what's going on?
Yeah, and Joanne, you had a great outcome from the surgery, and not that everybody's going to have a really great outcome or the perfect outcome in this case, but what we're trying to do is we're trying to give you a much better quality of life. And here on the right-hand side, midway through, it says pre-Inspire AHI. And what that is called an apnea-hypopnea index. And Joanne, before her surgery, she stopped breathing 21 times an hour every 3 minutes. The box next to it is her post-titration study after the implant was placed. And her apnea-hypopnea index is 2. And anything less than 5 is considered normal. And I know Joanne's going to talk about her outcome and how much this has changed her life. And this is a study that reflects what you're going to hear from her this evening. How do you schedule for the Inspire consultation to determine whether you're a candidate or not? You can call our office directly at the number listed. You can enter your phone number on the questions and answers, and we'll give you a call. Or you can come to our Arrowhead office. Please call the number ahead of time, and we will provide you some of that information. And something that's not on here is that you can address this through the Inspire website, contact them directly to get other information that you may need, and they will forward that information to us.
So guys, Doc wants you to see this short video, and then when it's over, we're going to go straight to Joanne to hear her story and go to Q&A.
In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work. And a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment #2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Saravo's memory got so bad, her family thought she had dementia. The 59-year-old was so exhausted, she says she could barely do her job as a nurse. So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep. Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
correct.
CPAP.
Correct.
So she tried other
Close
treatments.
it, take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air. The CPAP wasn't getting the job done, so you needed oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Mauritz Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
All right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is as good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experienced less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest, and now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep.
So,
What's it like to sleep now?
great. Turn myself on. Go to sleep. And I sleep. And then I get up and I turn myself off. And I have a normal day like you and everybody else.
Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did. It saved my life.
The ball.
Let it go.
Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy, and like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100%, and she's sleeping great at night.
So Joanne, that's Philadelphia. We want to hear about Arizona. Talk about your journey with Inspire for the folks out there.
So I started back in about 2017. My husband said that I was gasping for air. I snored a lot, and I'd always go into the other bedroom or to the couch to sleep. So I went to an ENT thinking that I needed another nose surgery, and found out that they sent me to the Valley Sleep Center for a sleep study, and found out that I had the obstructive sleep apnea. I went on an APAP machine, and things got even worse after that. I wasn't sleeping more than 2 hours a night. I ended up, things were just going way downhill. I was getting more forgetful. I had no energy. I fell asleep at the wheel twice in another lane. That really scared me. I thought the first time it was kind of a fluke. The second time, same thing happened. I fell asleep. I didn't get any car accident, but I thought that is very irresponsible for me to be on the road. So I took myself off the road completely. I then, my oxygen levels went down into the 70s, even with the APAP machine on. And I had an optic stroke and lost 80% of my vision in my left eye. So things were just continuing to get, bad to worse. And I started getting forgetful, where I thought I was starting to have Alzheimer's, and heard about the Inspire, went to one of these classes, and found out the insurance at that time wasn't covered in Arizona. So I continued trying with the APAP, but it was bursting at the seams. I was throwing it to the floor. I just wasn't getting any rest with it, and no rest without it. So finally, insurance covered the Inspire, had that surgery, and my life has totally changed now. I am sleeping 8 to 8.5. Last night I actually got 9.5 hours of sleep. I'm energetic now. I don't have, my eye doctor was very concerned about going totally blind in that eye. And with the Inspire now, he's not worried about it, because now I'm actually sleeping. There's, probably no chance I can have another stroke to lose that. It's just my energy level, I think, is the biggest thing for me, that I'm sleeping, and I just feel like a new person. I just feel like a new person.
That's excellent. So folks, if you have questions for Joanne or Dr. Perlstein, please ask. Joanne, we get these questions almost every time. Folks want to know, what was recovery like? And then do you feel the stimulation when you're asleep?
So my recovery was just, I felt like I'm a type 1 diabetic. So surgeries for me and all that, I take a longer time to heal. This, after 3 days, I was fine. Even after coming home from the surgery, I was fine. I did not take any pain medicine. I just took the antibiotics for infection. I put ointment on my wounds. I didn't put any ice. I was told not to put ice. I just put ointment on to heal the scars, and wore a sling for just, I think, 3 days. And as far as what I feel during the stimulation, when I turn it on, my tongue kind of juts forward a little bit, and then it stops. I have my remote set for 45 minutes to go on, because before I had insomnia as well. I've actually, the Valley Sleep Center helped me with that as well. But I have my remote set to 45 minutes, and my pause time on my remote is 20 minutes. So if I get up with, low blood sugar with my diabetes, I'll just press the pause button and then go back to bed, and it comes on in 20 minutes. So the stimulation, if I wake up in the middle of the night, sometimes I don't even know it's on. I'll get all the way to the kitchen, start to drink some, soda or something like that, some sugar, and realize that I forgot to turn my pause button. So I've become so used to it. I was implanted on October of 2019, and a success by February of this year. So in that just short time, to become a success and to, again, feel like I don't even feel like it's on anymore is amazing to me.
Well, Joanne, we can't thank you enough for helping others. You're volunteering your time for free out, and we just can't thank you enough for that. Talk about the sleep remote for someone that says, gosh, I'm not that techie of a person. Was it hard to learn, and how do you use it?
Not at all. So I have my remote right here. So I put it up against my chest where the device is. I press the green button. On the back here are your settings. So when you're going through trying to find your sweet spot, I'll call it, there's a plus and minus button here. You'll press the plus to go up a level at a time every few days. If it gets to be too strong, where it gets to be painful, then go back down again. And then again, if you get up in the middle of the night to use the restroom, or like me with sugar, I press the green button. That pauses it. Don't turn it off when you get up. But then when you get up in the morning, you'll put it up against your chest again and press this white button. Very easy to use.
Excellent. Doc, if somebody says, gosh, I want to make an appointment to see you, about how long until they can get in?
Generally, it's within 1 to 2 weeks. The holidays are always a difficult time. But by and large, and in average, it's going to be 1 to 2 weeks.
Joanne, if someone says, this sounds great, but I really would like to talk to somebody one-on-one, is that something you'd be willing to do for one of Dr. Perlstein's patients?
Absolutely. And I also talk to people all over the country on Facebook as well, people that are on the Facebook Inspire site. So I reach out to people all the time. I talk to them through Messenger, and then we actually talk one-on-one, because a lot of times it's hard to ask questions. So absolutely, I'm happy to help anybody who needs it.
Wonderful. So folks, write down the number 623-566-4718, or take a picture of that with your phone. We'll wait on your final questions. Doc, insurance, is there any insurances that you don't accept?
I don't think so. I mean, there's the rare one. I have a referral base. I saw people from Lake Havasu today, and I saw somebody up near Page come down. So they're coming from far and wide. And if we have an insurance that's an unusual, we'll do the best we can. But one of the things that does happen, even if you're out of network, there aren't people that are able to do the implants possibly where they're coming from. So we can obviate that. But generally, if you live within the greater Phoenix area, it tends not to be an issue.
Wonderful. So Joanne or Doc, any final thoughts about Inspire or anything else on your mind?
No, Joanne, I think your outcome, I think you're a wonderful person, for what you're doing for what we have to offer. And you really have had a fantastic outcome. And I think what people need to understand is you may not do as well as Joanne has done. Many people do, but most people really have a change in their quality of life and on many levels. And I can't, Joanne alluded to this, that it really does touch many parts of your life, emotionally, psychologically, physically, your relationships that you have at home. And Joanne is an absolute testament to this.
And I'd like to say to the people out there, this is not going to happen overnight. You have to, my biggest probably advice I give to people is you just have to be patient. You can't expect to get to your number the first night, the first week. It's going to take time for you to find where that setting is perfect for you. Even my setting, when I went in for my final, or I didn't know it was my final one, but my sleep titration study, I was much higher than I should be. And then once I finished my sleep study, I actually backed down two notches on my setting. So again, just take your time. You'll get there. You just have to be patient.
Excellent. Well, it looks like we have a final couple questions here coming through. Somebody's asking Doc about central sleep apnea in addition. So I think you mentioned it before, but the indication is for obstructive sleep apnea, and the centrals have to be under 25% of the total. Is that correct?
Yes. Yeah, if you have central sleep apnea, which there are a number of reasons for that, and sometimes it's side effects to medications, sometimes it's coexistent illnesses. And as we age, I wish we were all perfect when we age, but we're not. And sometimes we have to take medications for things, and they can have an impact on how your brain works, particularly in this setting. But we have all of that information when we do get a good qualified sleep study. That is something that we look at. And I'd have to say that it's not that common that we get somebody who has central apneas that prohibit them from having an implant placed.
Excellent. Well, if you guys have any final questions, please ask. Otherwise, Joanne?
One more thing. So I had mentioned earlier that I'm a type 1 diabetic. I wear a device that tracks my glucose. It's called the Dexcom. That is a Bluetooth device. And when I first got my Inspire, my Bluetooth device, I think, was too close to my Inspire device, and they were turning each other off. So we figured that out kind of the hard way, that I have to put my Dexcom a little bit further away so they don't interfere with one another.
Excellent. Well, sorry, I was just answering a question. We had a final one. Folks, thank you so much. Doc, thank you for your time. I know you're very busy. You really like helping people, and you're a great asset to the community. So thanks so much. And Joanne, you are just a wonderful person. You're an Inspire angel, if I were to try to come up with a term.
That's what we called ourselves, the Inspire angels.
Thank you, Ben.
We do have one final question. I've never had this before. Somebody said they have severe sleep apnea with a side effect of acromegaly. I was told, that's a physician question. I would just call Doc and get an appointment to see him.
Yeah, that's a very complicated thing, because you really have to get a really detailed assessment of the head neck anatomy, because acromegaly, obviously it affects everything, but that really is something that has to be looked at from an individual basis.
Wonderful. Well, thank you guys. Everybody have a nice evening, and we'll see you guys on the next call.
Thanks, Ben.
Bye. It was nice meeting you, Dr. Perlstein. Bye-bye.